we're helping you get your child prepared for a successful year. And one thing that could be overlooked is eye health. Dr. Tamiesha Frempong joins me now. She is a pediatric ophthalmologist at New York Eye and Ear Infirmary of Mount Sinai. Thanks so much for being here.
Thank you for having me. Happy to be here.
Now, okay, so how does eye health impact, childhood development and learning?
Well, when infants are born, before they can even do very much, they're using their eyes to explore the world around them. Mm-hmm. And the eye takes in visual information, sends it to the brain, and helps them understand the world around them and interact with it. So eye problems and vision problems can cause developmental delays. It can impact motor, language, and cognitive development.
Wow, so that's why it's so important to get the eyes checked out at a young age. What are some of the signs that your child might need glasses?
Yeah, so infants, initially, the visual system is underdeveloped. Mm-hmm. So signs in an infant over time that they're not seeing well would be poor tracking, shaky eyes or nystagmus, eyes that don't stay straight, either wander in or out, for example. Mm-hmm. Or if you see something abnormal in the red reflex, like a white reflex, could be a sign of a cataract or even an eye tumor. Mm-hmm. In older kids or school-age kids, if you notice that they're squinting more, or being very close to the TV, or holding objects very close to them, or being resistant to reading or near work, these could be some signs that they may need an eye exam and they may need glasses.
So, we know learning these days, so much is on the tablet and on the phone and that sort of thing. How does that extra screen time affect our kids' eyes?
Yeah, the evidence there is a little shaky. We know there's a trend towards impact, particularly towards something called myopia, which is nearsightedness, where the person can see well up close but not so well far away. Mm-hmm. But it's unclear if those digital devices, if there's something unique to them, or if because it causes prolonged near work, mm-hmm. because we know holding objects closer than 30 centimeters to the face mm-hmm. can contribute to myopia development and progression. Also, there's real evidence that spending more time outdoors in natural sunlight can impact a chemical in the back of the eye that impacts the length or growth of the eye, causing myopia. So it's not clear if those devices themselves mm-hmm. are problematic, or because they cause kids to hold things too close and cause kids to stay inside too much.
But I'm guessing you should limit the screen time.
100%.
Okay.
There is something called computer vision syndrome, mm-hmm. where prolonged near work, we don't blink as much as we would in natural conversation. Mm-hmm. The eyes can dry out, the vision can get blurry. Overfocus can also cause some eye pain or visual strain. So there's some rules about good device etiquette. Mm-hmm. So for example, there's something called the 20-20-20 rule. So for every 20 minutes you're on one of these devices, you should take a, say, 20-second break and look 20 feet away. Oh. Basically out a window, down a hallway. Just let the eyes relax for a little while.
Great idea, 20-20-20. I can remember that. Dr. Frempong, thank you so much for being here.
Thank you too.